Castellano here, the Smile Doctor. We're here today with Jennifer. Thank you for letting us share your video today. Never had filler before, right?
Nope.
She has come to the right place. We're so excited. So we're going to do a little bit of Radiesse. And to try, Radiesse is a good filler to start things out so people can convince themselves, I like it, it looks natural. We talked about the smile lines through here, a little bit in the cheeks. We're going to focus there, and then when we bring her back, we'll say we're happy, we like it, or if we want to add and build, then we can. Any questions about our goals for today?
I don't think so.
Okay, very good. So I'm going to do a little cleanse on the skin for the physicians and students that are watching. And of course, we have her pictures, the before pictures, so we can always see and compare. After we do a cosmetic treatment, our vision gets better and our memory gets worse because we really look at ourselves so closely after we get a cosmetic treatment. The vision gets better and the memory gets worse. We forget what we used to look like, so that's why the pictures are so helpful. For the physicians and students that are watching, I like to use the Hibit cleanse and an alcohol prep. It's very rare to get an infection from filler, but that's why we do the cleanse. I'm going to have you rest your head all the way back. So a little cleanse on the skin where I'm going to insert the cannula. I will be using safety cannula. For our treatment today, I like to use a 27 gauge, 1.5 inch. It gives you a lot of control. It's much less traumatic than a needle, less bruising, less risk of getting the filler into a blood vessel, causing scarring, loss of vision, damage to surrounding structures. That's why you want the expert injector in the safety cannula. So when we use the numbing medicine, I like to use the little vibration device. Let's see if this, there we go. So you'll feel buzz, and then pinch on 3. 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad.
No, it's not bad.
Buzz and pinch. 1, 2, 3, pinch. I'm not in a hurry if you need a break. Once I numb these little areas, the rest of the treatment is much more comfortable. 1, 2, 3, pinch. We mix numbing medicine in with the Radiesse. There's already lidocaine inside the Radiesse, but I mix a little extra to make it less viscous. Buzz and pinch. 1, 2, 3, pinch. And also to add a little bit more numbing. 1, 2, 3, pinch. Buzz and pinch. Doing okay?
I am, thank you.
She's tough. Okay, so now I use the little 27 gauge that makes the insertion point where we're going to place the cannula. You feel a little pinch there, not too bad? Because the cannula is blunt tip. Little pinch. And that allows the cannula to get through the skin into the subcutaneous. There's two general ways you can use fillers. You can, if you think of, you feel a little pinch. If you think of the face like a mask, the thickness of the skin, the facial mask, you can inject directly into that. Or you can inject deep to it, that's in the subcutaneous, that's what we're treating today. Or you can do both. Now with Radiesse, you don't want to inject directly into the facial mask because you'll see it. So we keep these well below, you don't see it at all when you're doing it the right way. That's why you want an expert injector. Okay, so we start in the smile lines, and when you're injecting the smile lines, the lip will feel numb, and patients will tell you, they'll say, my lip is feeling numb, is that normal? And the answer is, yes, it is normal. So a little twist technique, you find that little insertion point, twist, 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 little pinch. Subcutaneous, twist, twist, twist. You feel big pinch, little pinch, not too bad?
No, not really anything. Just pressure.
You might feel a little pressure, that's normal. And I'm doing about 2 to 3/10 of a cc in the right nasolabial fold. And I use the shiver technique that allows me to put a very small amount of filler over a large area. I'm also doing the tapping, which is helping me to, I'm dissipating a little bit of the filler, doing a little bit of a massage as I'm injecting it. And also it's a sensory distraction, so she feels a little less of what I'm doing. Now the numbing medicine is going to be doing its job as well. So all that combination makes for a much better experience. It breaks my heart when patients tell me they went somewhere, they had injections, they said it was very painful, or they had a bad experience. That's why you need to have it done the right way the first time around. So we're glad that Jennifer is here. You doing okay?
And thank you.
Very good. So same thing on the other side. I like to go immediately to the other side because that allows me to inject about the same amount, essentially the same amount, on both sides, maintain the symmetry. We always have one crease that's a little deeper than the other. And not only do we have facial asymmetry, but we have a dominant side of our face. We may smile or express ourselves a little more firmly on one side versus the other. So it's very normal that we have that facial asymmetry. And we usually may not notice that until we do a cosmetic treatment. Everything's looking good. Perfect. So now it's very normal that we lose volume here. You turn your head this way a little bit. We call this the Milo labial fold in the pre-jowl area or pre-jowl sulcus. Pressure, pinch, twist, twist, twist. The twisting allows us to advance the cannula as atraumatically as possible. And again, I'll probably use another.
Oh, sorry.
Oh, that's okay. What did we do before we had all of our alerts? Everything's looking good. So massaging, things feel nice and smooth. There's no restrictions afterwards. I like to recommend a 5-minute massage 5 times a day for 5 days. You can get your phone if you need to. You want to grab
Should
that?
I just turn it off?
Yeah, no, it's no problem.
Sorry, that's my alarm. There we go. Stop.
Okay. So it's looking good. She's definitely going to pass the grocery store test today. We walk into the grocery, no one does a double take. Let me turn your head this way just a little bit. Pressure, pinch, pressure, pinch. Tapping. Everything's looking good. It's important to tell your patient what's going on, reassure them. Because while they're having it done, they're thinking in their mind, they're like, is everything okay? Does he like it? Is there a challenge? You let them know everything's fine. It's looking good. My patients will tell me, they say, well, you just say that all the time anyways. I say, when it's looking good, I say it's looking good. If I'm not happy with what I see, I make it the way I like it, and then I'm going to tell you it's looking good. So we take little baby steps. You're not going to get into trouble when you're taking little baby steps here and there. When the plane is in the air, it goes on course, off course, on course, off course, on course, off course. It gets you to the destination. So we're just adding a little bit here, a little bit there. I could stop right now and she's going to have a great result. Well, we're just going to keep building on what we've done. So we're always keeping her safe, always keeping Jennifer looking natural. Family and friends will not figure out what she's had done. I'll turn your head this way just a little bit. That's good. Looking very good. I'll put just a little touch more here. And my team has everything set up perfectly for me. Makes it very easy. Thank you to Brittany and Charlene. And Yesenia here today. We got the A team. Twist, twist, twist. You feel a little pinch here? Not really?
Yeah, I mean, just tiny.
Very good. Okay, so now we're going to focus a little more on the cheeks. Radiesse is a calcium-based filler. It's a good collagen stimulator, lasts about 1 year to 1.5 years. We do have permanent fillers, and Radiesse is a good one to start out so you can feel good about it, know that you like it, and when you're ready to do something longer term, then you can do that on the next visit. This is artistry. There's no 100% right or wrong answer in how we do things, but we do have our ABCs of plastic surgery that keep us in check, right? A stands for area, 4 main areas that we address. You feel a little pressure, a little pinch here. pressure, pinch, pressure, pinch. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin. You can polish and repair the skin. Feel a little pinching there. The fourth area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift when we smile. The smile always looks the best. Everything's looking good. So it'll feel a little bit numb and goofy under the eyes, and that's normal. Sometimes patients will even feel a little numb on their upper eyelid. Totally normal. Very good. Twist, twist, twist. It's a subcutaneous injection. Perfect. And I'm using about a quarter of the syringe in each one. And what I'm going to do after I'm done right here, I'm going to show Jennifer what we've done so she can see, and then we're going to talk about where I'm going to use the rest. So this way she's in control, she knows what she's getting, there's no surprises. Jennifer has many, many active years ahead of her, and she is definitely one of our A+ students looking for extra credit. Patients today are living longer and want to look their best. We don't want to wait for the advanced aging changes to set in. Okay, so now that I've treated in these areas, so let's take a look at what we've done so far. I want you to open your eyes for me. So can you see how it softens around the mouth?
So pretty.
Do you like what you
Much
see?
better, yeah.
Make a big smile for me, big smile. Now relax as best you can. So what I'm going to do is I'm going to build just a little more through here, and then just balance and blend through the cheek. And do you want anything, how about down lower the superficial creases? I'll do a little bit more through there, but I can't take those away 100%. But is that okay if we do a little through here and then just balancing in the cheek? How does that feel?
That seems perfect.
Okay, very good.
Yay.
If Jennifer's happy, then I'm happy. Okay, very good. So this is artistry. You know, you get the hang of it after a few thousand. I've done over 20,000. And I am definitely a much better injector than when I started, or even after doing 10,000 syringes. It is a lifelong pursuit of looking natural, keeping our patients safe, and doing things the right way. I'm going to turn your head this way. So if you have questions, give us a call, or you want a virtual consultation, 813-463-9245. We will help you raise your cosmetic standards. We'll keep you safe. Remember, a lot of the injectors that are out there, a lot of them are beginners. And so you got to be careful with who is taking care of your face. Do not settle. Okay. A little more on this side here. I like to recommend that 5-minute massage 5 times a day for 5 days. If you feel a firm area, just keep massaging and it's going to soften and settle. And I tell my patients if they need anything before that 6 to 8 week follow-up, call us at any time. Okay, so a little bit through there. Now I'm going to balance and blend a little bit more here through the cheek. Perfect. Everything's looking good. Fillers are the future. No downtime, natural looking results. I'm going to blend a little bit here in the submalar. They're safe when you have the right injector. Instant results. And we get a little hollow here. I'm just going to add just a touch there. Very fine amount for balance. Very good. Big pinch, little pinch, not too bad.
No, not bad at all. Really
We try and make it easier than going to the dentist's office,
feel.
or easier than getting a tattoo. Okay, very good.
Lizzie Rivera says, is this Botox or plasma?
So this is Radiesse. Botox is a wrinkle relaxer, softens the creases in the forehead, glabella, and crow's feet, and even around the mouth. Botox lasts about 3 to 4 months. So it's a popular treatment. Fillers are more popular. Plasma can work like a filler. Plasma, you have to draw your blood, you spin it down, you can add it sometimes with different substances. And most of my patients that have had plasma say that they get maybe about a year's result. So we have fillers that last longer, and I think that it's better for collagen stimulation to use a Radiesse or other type filler rather than the plasma. I just don't see an advantage to that. People like the idea of saying, hey, I'm getting stem cell, but at the end of the day, are your results better? You know, we have the permanent fillers, so we can give you long-term results, longer term than plasma. So I think plasma is a realistic alternative, but I think we have better alternatives. Sculpture lasts 2 to 4 years. I think it's going to give you a better result than what plasma will do. And of course the Bellafill. And I think Radiesse is a better collagen stimulator. So many options to choose from. More important than choosing plasma, you got to choose the right provider, the right artist who's going to be treating you. That's really what matters most. Now, we're completely done. Hopefully that wasn't too bad. So I tell my patients you don't want to taste the chocolate cake before it's done baking. So there's a little bit of swelling, right? Not too much. You'll still pass the grocery store test. The swelling goes down. The collagen's going to build. Make a big smile, big smile. How does it look so far?
Looks
Are you
great.
happy with what you see?
Yes.
So this is what a filler experience should be like. For those of you out there who have gone other places and didn't get the experience that you want, we apologize if that happened to you. Come here, we can do it the right way. So 6 to 8 weeks we'll check in. If you feel any firm area, you can't hurt the filler. You can massage in the cheeks, the smile lines through here, and call us if you need anything. Any questions?
No.
Okay.
Great.
Congratulations. I give you hugs and hugs from here. Hugs for you guys as well. We're here to help you raise your standards. Happy New Year. Give us a call if you have any questions. We are here to put a stop to bad plastic surgery. I'm Dr. Rich Castellano, the Smile Doctor at Image Lift. Thank you for watching.